Hi, I'm Dia Hamid, consultant psychologist of Haridam Child Development Center, Calicut. Today, I'm going to discuss about the topic social phobia, which many might be aware of, but some might not. So, I would like to start by telling what is social phobia. Social phobia is a mental health condition where an individual have extreme fear or anxiety when dealing with a social situation or a social gathering or just being around people. It is normal to feel nervous or shy when dealing with a new social situation. This might not be necessarily the sign of having social anxiety disorder because our comfort level in dealing with different social situations may vary depending upon our personality traits and our experiences of being in such kind of social situation. But the fear of being judged or being scrutinized by the others is leading you to having a difficult social relationship or is disrupting your daily life routine, then that is known as social phobia or social anxiety disorder. And a type of social anxiety disorder is performance anxiety. Now, what is performance anxiety? Performance anxiety is when you have extreme fear and anxiety in performing in front of people, such as speaking or presenting a topic in front of public, but not in general social situations. Social anxiety disorder typically begins in adolescence, but some might have it at a very young age or at adult life. It is common in both men and women to develop social anxiety disorder. It is majorly caused due to the low self esteem and the fear of having criticism by others. Some of the symptoms of social anxiety disorder might be fearing that you're being negatively judged by others, that you are creating an embarrassing or humiliating situation for yourself, for others to make fun of you, or fearing that others are watching you being anxious, fearing of being the center of attention, fearing of interacting with unfamiliar people or with a stranger, are all signs and symptoms of behavioral and emotional symptoms of social anxiety disorder. In contrast, shivering, shaking, trembling, having increased heart rate, increased breathing rate, having dizziness or feelings of nausea, or mind being completely blank are all the physical signs and symptoms of social anxiety disorder. Both emotional behavioral signs and symptoms and physical signs and symptoms of social anxiety disorder will eventually lead an individual to avoid common social situations, such as having to interact with an unfamiliar person or a stranger, having to use a public restroom, having to eat in front of others, having to enter a room where people are already seated, are all some of the situations that a social anxiety person might avoid. What are the causes or the risk factors of developing social anxiety disorder? Genetics can be said as one of the major role of developing a social anxiety disorder. Research findings suggest that children having a family history of anxiety disorder, particularly social phobia, are more prone or more risk in developing that condition. The predisposition can influence how the child deals with a stressful or a fearful situation. It is not just the genetics that is causing social anxiety disorder. It can be environmental factors such as having an overprotective parenting, being bullied, or being socially rejected previously by the public. And shy and introverted children are more prone to developing social anxiety disorder or social phobia. Having stated the symptoms and causes of social anxiety disorder, now let's look on how to manage these and how can a parent and a psychologist help children facing social anxiety disorder. As a parent, we can encourage the child by giving them a supportive environment that is validating their feelings instead of forcing them into social situations, and avoiding being overprotective to them and motivating them to make conversations or interact with others in a social gathering. Parents can encourage the children in taking the tiny steps into social situation, such as playing with a friend and then moving on to a larger group of people. Parents are the role model of children. Children do look up to their parents. So it is important for the parents to show what is the right way of interacting in a social situation or how to make a conversation with others. You can do it by role playing or modeling what is right and what is wrong. You can reinforce the children into social situation by praising the little efforts they take into making interaction in social situation. As a psychologist, we can help these children having social anxiety by understanding or making them realize what are the negative feelings or the irrational thoughts that they have in dealing with the social situation, and converting them into more rational and more positive thought. We can also help them by gradual exposure into social situation, such as initially helping them deal with the easier task and then with the difficult ones. If therapy or the previously mentioned steps are not helping the child deal with the discomfort that they have in social situation, medications can be used or medications can be prescribed. It is important to seek treatment and manage it at an early age in order to prevent the long term effect in the child's social development. Social phobia or social anxiety disorder is treatable and it's curable if proper support is given from parents, teachers, psychologists, and their peers. Hope you understood what is social phobia. We'll be coming up with more videos discussing about various other topics. Thank you.